At The Tiger, we get a lot of questions from our audience about the prospect of coming to Thailand for medical tourism. To that end, we've created a series of podcasts in partnership with Allied Health Thailand to shed more light on the industry so you can make informed decisions. A medical tourism service that basically is one-stop shopping for all of your medical needs if you're coming to Thailand. Today, we're joined with Dr. Saran of Wansiri Hospital. Dr. Saran is a leading figure on gender affirmation surgery with decades of experience in the field.
For 30 years, we've been develop a lot of our special technique. In my hospital, we're doing like 100, 200 a year. The easiest one is about 2 hours, and the recovery is about a week. So including the airfare, hotel services, still cheaper than have a surgery back home.
As Thailand has established itself as the leading country for gender reassignment, Dr. Saran is playing an incredibly important role in empowering the transgender community to lead the lives they'd always envisioned for themselves.
They are different. You cannot use yourself to judge is that you and I are the same, so you have to. They are different. They have to living as a female on the hormones for certain years. While they are in this process, they cannot have sex as men. So this process takes years. The psychologists will analyze, screening that they are good candidates. What we're doing is we make them not male. So we try imitate the nature, but we cannot guarantee that it's 100% female. But this is good enough for them to living with dignity.
Let's find out more about the processes involved with one of the industry's celebrated leaders. All right. Good evening, good afternoon, good morning, wherever you're coming in from. Thank you guys for joining us for another episode of the Tiger Podcast. Today, we're going to be talking about a very interesting hot topic about transitioning and all that comes with it. But before we begin, I want to give a shout out to our sponsors for this show. We are partnered with Allied Health Thailand, which is a medical tourism service provider that can basically, it's one-stop shopping. They have amazing doctors on hand, on staff, to be able to help you, to connect you with the hospitals and medical professionals that will suit your needs, that are totally tailor-made. It's an amazing service, and will basically hold your hand as you go through these complicated processes to make sure that you are getting the care that you need and exactly what you're looking for. So thank you, Allied Health Thailand, for sponsoring this podcast. Now, let's begin. Please, Dr. Saran, thank you very much for joining us today. Would you mind to introduce yourself very quickly?
Thank you. My name is Dr. Saran Wannachamrat. I'm a plastic surgeon, certified board plastic surgeon in Thailand, and I'm graduated about practicing about 30 something years. So all the ways from the beginning, and now I have my own hospital called Wansiri Hospital.
Where's the hospital? Can I ask? Yeah.
Rama 3, Bangkok.
Yeah, gotta love it. Yeah, beautiful Bangkok. So you've been at this for 30 years. Quite a long time.
Yes.
How have you seen the field shift and grow in that time?
Actually, we're starting from nothing. Some of our staff is training from abroad, mostly in the States. And with our slowly development, we're trying to training and transitioning patient. And at that time, we're still learning about the technique and everything. So for 30 years, we've been develop a lot of our special technique and become our own knowledge. And this knowledge is teaching from our mentor to our generation and a lot of development. Now we can compare to natural women. Yes.
That is very fascinating. I mean, it's grown so much, not only in the medical techniques, but also in the cultural acceptance. So what do you think that makes Thailand such a popular destination for gender reassignment surgery?
First of all, we have to understand that Thailand is very good quality of medication. So you have seen a lot of hospital that is certified, guaranteed by some standard accredited, like JCI or HA or whatever. That means the standard of the hospital is very high. The other thing is cost effectiveness, because the cost of the transition in Thailand may be the fraction of the cost of European country or in the States. So with the cost effectiveness, I think it's comparable. The other thing is the legal and cultural, because of the legal and cultural in Thailand is more the diversified, and we can say that we are more generous. And now we have the law that we can marry to the same
sex,
same sex, and we also acceptance in the differentiation. So you can see that Thailand is a bit multicultural in everything. Thai people is blended to every religious. We celebrate Valentine's, Happy New Year's, Chinese New Year's, Indians festival, yes, a holy festival, everything. We blended, we acceptance, and we can say we are more generous and blended. That is the culture of Thai people. That's why when you are in Thailand, you feel a little bit relaxed. Yes, and the most important is we have the knowledge. The doctor is well training in this field of surgery for a long time. So we have knowledge and very talented doctor training in our medical school.
Yeah, the expertise is something that is always talked about here in Thailand, and especially when so many of the doctors are training in some of the world's class facilities in the West and things like that. But Thailand itself is becoming very world class.
Yeah, because the number of the patients, a lot of number of patients. Like in my hospital, we doing like maybe 100, 200 a year. That means there's a lot of patients in for one doctor. So that means a number of patients is a lot. So doctor have knowledge and the teamwork is very good. We're training some doctors to do the colon by laparoscopic very fast. That's why we have a very standard, and you can rely on the term of surgery team. Yes.
Yeah, you mentioned earlier about like the cost of doing gender affirmation, gender reassignment, whatever we want to call it. The cost is a fraction. Can you talk about the numbers a little bit? Like what would it cost, say, in a country like America, and what does the number look like here in Thailand instead?
The cost may be starting from the easy one, maybe $7,000 to the most complicated, maybe $20,000. So including the airfare and hotel services, still cheaper than have a surgery back home in Europe or in Australia or in the States. And because the number of the doctors who can do the surgery is not much, so they have to be queuing. So some of the patient who don't want to waiting on a line, they have a shortcut coming to Thailand, have a surgery, and then going back home working. The surgery time in my practice is for like normal sex change. The easiest one is about 2 hours, and the recovery is about a week. So after a week of hospitalization, a week of recovery, remove stitches, they can go back home working.
Well, that's a pretty quick turnaround. Able to get back on your feet very quickly.
Yes.
So, well, okay. Obviously, there's the gender reassignment surgery itself. What is Can you tell me more about the process of going through this? Like in the preparation leading up to it, what kind of medications do you have to take? Maybe the more holistic approach.
One thing first, we have to understand that this type of patient is not like me and you or one of they are different. Before I'm in this surgery field, I am thinking, why don't you change? You are a man. You have to be walking like a man. You have to be thinking like a man and dress up like a man. But they are different. You cannot use yourself to judge is that you and I are the same, so you have to. They are different.
Right.
They cannot change to be like us. So the only way is they have to change is their body to match their mind. That one thing first. So this process have to be analyzed with psychologists and doctors back home. If they are screening, they are one of the candidates for surgery, then they are on the process of what we call is cross-dressing. They have to living as a female for certain years and on the hormones. And meanwhile, they are in this process, they cannot have sex as men. And they have to be on the hormones and such like anti-male hormones and female hormones until their body is ready. And then they are coming to surgery. And that time take about 3 or 4 years, something like that.
That's very fascinating because it just goes to show you that this is not like a lot of people think, oh, I just wake up and decide one day, you know what, I want to do it. No, it's not. There's a big process and you spend a lot of time living this lifestyle before you commit fully to it. It's very fascinating. Yeah. What do you, have you ever seen any patients that have sort of changed their mind going through this process?
No.
Yeah.
I've seen a few, but actually the process of changing their mind or reluctant is not arriving here. They might have this process before arriving here. So the psychologists will analyze. They have like examination to test that, like draw pictures or written something in examination. And if they pass the examination, they have to test a lot of tests and talking until they are screening that they are good candidates. Maybe some of them is so smart they learn how to answer the question, but the psychologist will analyze. So this process take years. If they are passing the psychologist, it means they have less number of patients to change their mind. They're good candidates enough.
Yeah, it seems like once the decision is made, like there's follow through.
Yeah, I am at the end of the process. Like they're screening and cross-dressing and living as a female, something like that. From day one until the day surgery, I'm at the end of the process. But behind this process is the point of no return.
Yeah.
So before you coming here, you have to make up your mind. And then after this point, you cannot coming back. That's what.
Well, it's a very serious medical procedure.
Yeah.
Like, so it makes sense that there is such a long process to make sure that the candidate is qualified and is actually, a suitable candidate for the process. So it's great. Like, I think a lot of people have this misconception that like people are brainwashed into it or something like that. I think that is absolutely not the case. It's something that is a very deep and personal choice, and it's a personal journey. And I think it's a wonderful thing that you're allowing people to live life how they want to be living it and seeing it seeing themselves how they want to be seen in the mirror, I think.
Well, one thing I want someone who not in this situation to understand that they are not like me and you. They are different, and they are compressed by social, by family, by everything. So they don't know where to turn their face to. They don't know anyone who can talk to. If they're living as a male, so that might be depressed, or they might be perform as a male, married to a woman, and then they might have something bad to their families, to their sprout. So that's not good because they are different. They cannot, they can have hidden, but they cannot be straight like what we're doing. So transgender is different from gay because gay is a sexual life. That means you want to have sex with same sex. But transgender is they are female hidden in male body,
Right.
or female hidden in male body. They cannot change.
Right. Yeah. That's I just speaking of this, we've actually had one of our guests on the podcast before is a woman who has gone through the gender reassignment surgery, and talking with her about it and her journey, the challenges that she faced, right, from her family, from her social life. She joined monkhood for a little while, actually, just to I don't know, try and find a new community of people to be around. And these days, she's performing in drag shows all across Thailand, and happier than she's ever been, hanging out in Silom a lot of the time. But this is something now they can find. There is more community now, and there are more options and more acceptance amongst people. Of course, family is always one thing, but there are communities that are supportive.
Yeah,
And it's changing.
One thing is, if they are, mostly they are one of the part of our society, but now they're hidden. They cannot stand out, cannot show themselves that they are different. But if we have a chance for them to stood tall, then one day they can turn back to the society and help the society. That's what we're doing.
It's a wonderful cause, I think. What is okay? So there's the gender reassignment. What other surgeries do you offer at your hospital in terms of helping the whole process of transitioning?
Plastic surgery is a bit different from others because we modify. Plastic is mean remade it,
right,
in Greek. So that means we do something else from the beginning and change a little bit. We can do surgery for the face to look younger or change to look more attractive, because in American way, the first impression is your look.
Yeah.
If you are good looking, the door of opportunity is open. So that's why the first impression is very important in American point of view. The same thing. If you are good looking, the world might be more generous to you. That's what we are doing. So we do facelifting, we do eye surgery, nose surgery, breast, everything. But our hospital is a bit different because in terms of the cosmetic hospital, normally there are general plastic surgery. Like one doctor did everything. So one doctor can do eye, nose, breast, sex change, something like that. But our hospital is highly specialized. We divide it into department and we screening the doctors for you that this doctor is specialized in eye surgery as 1, 2, 3 in the department. The other is a nose surgery, which is a very high ranking reputation in the department. So we selected most of them to our hospital. And most of them is accredited. They are one of the member of ISAPS, International Aesthetic Plastic Surgery Society. And all of them have a very good reputation and well trained.
So that's having them highly specialized means that you're going to get like much higher quality of maybe results.
Predictable.
Yeah.
Like when you want to consult the doctors, you're starting with which doctor do the eyes good, which doctor do the nose, good reputation, and you go consult them. So our hospital screening for you, or our partner Ally Medical, they screening doctors for you. So this is the screening process. We make sure that all doctor is accredited by society or hospital, and this doctor is good reputation. We have before and after pictures. They can consult you online, make sure that they understand what you want. And can consult them. If you feel okay, then you can start make decision. Because you can go to any place in the world, but you might not go to the place at the cheapest surgery for a lousy surgery. You have to make sure that it worth every dime you're doing surgery.
Yeah, I mean, obviously, price is a consideration. It should not be the only one, though. I think.
Correct.
Yeah,
correct. Agreed.
Well, that's very fascinating. You have so it's kind of one-stop shopping for this reassignment, right?
We hope.
It's good that you can keep it.
Our hospital is the only one hospital that we have multi-talented doctors screening, because we know that if you want to consultation, you want to consult to the top surgeon, but the top surgeon, which one is good for eye surgery, which one is good for nose surgery, you have to shop around. When you combine together, maybe not have a good result. So we have simulation before surgery. What your expectation after surgery? Can you deliver this, or a doctor have any point of view that we offer you that maybe this one is better? Then if you like it, you can process after that. You can see where you're going to. A doctor is like a taxi driver. If you don't show the destination where you're gonna go, so doctor also don't know. Now it's not the time that doctor is like, trust me, I bring you to the place. I'm the very good doctor. But you don't know how they're gonna look like after surgery.
Can't see the destination. Yeah.
And how do you imagine that I like this nose in my face, but if it's on your face, is it gonna look good?
Yeah.
So we have simulation.
Right.
And you can at least estimate it. You're gonna look like this after the surgery. So roughly you see that, and if you like it, then you can process.
Yeah. So when you say simulation, what is this? Just you can see some images where it's brought onto it.
Yeah. We have a machine that we scan your face and then you simulate it, how you're gonna look like or what you're gonna look like, and is it fit for your face? In your point of view, not too high, not too pointed, maybe not the same.
Yeah.
Because this is comparable, comparative. Your height maybe not same as my height. Your weight maybe not the same as my weight. So this is just a comparable. We have to make it clear. Picture tells 1,000 words.
Indeed.
If you give me picture how you want to look like, then I can show you that is it fit for your face or not, and we can offer you a professional point of view that this is maybe better in your face or something like that.
Yeah, that's it sounds fun actually. I kind of want to play around with that machine. Yeah, it's interesting. And like you said, being able to visualize what it will look like with my features, that's important.
Correct. Because now there's the era of the Photoshop. You can do this, we can do that. And if doctor want to take you to the destination, he said will be good for my face or not.
Yeah.
Or any other option else, any design else, something like that. What can you offer beside the cost effectiveness, the standard hospital? The design also very important. The taste of the doctor is very important.
Yeah. So I thank God for Photoshop. Every time I have to take my shirt off for one of these shoots, I have abs now. Thank you for that. Anyways, I should exercise more. But all right, let's get back into a little bit more detail about the gender reassignment surgeries themselves. What are the different types of gender reassignment surgeries, and how should people choose which one?
We have the male to female and female to male. But my expertise is male to female only. Unfortunately, I'm not the one who training for female to male, so I cannot say in the terms of male to female. But my expertise is male to female, which is we made a female genitalia, and we can do the length of and the depth depends on patient, which is maybe composed of the colon surgery, something like that. the more details.
So it's very specific then, like each one is like for whoever the patient is, there's more considerations.
Actually, the colon surgery is not just only for male to female. We develop this technique for female who congenital doesn't have vagina. And some of the female, some of them doesn't have vagina. So we have to develop this technique for female. And this technique also used for male to female also.
Okay. Same. So what is the point of that process? Why do they do that?
Actually, we make long story short. We make a tube. We find a tube and anastomosis to the opening of the vagina. So this tube may be from colon cylinder and close one end and pull down to make a vagina, or we can molding the tissue inside your abdomen. We call peritoneal flaps. Yeah, we molding and we make a tube and pulling down to make a cavity lining.
Wow. Ooh, I gotta cross my legs real quick. Yeah. No, it's wonderful that like, how does it compare to like a natural vagina? Like for example, is it cannot.
You cannot compare to the normal vaginas, because what we're doing is we make them not male. They think they are not male. So we try imitate the nature, but we cannot guarantee that it 100% female.
Right.
But this is good enough for them to living with dignity. That is the most important. We try to make a outlook as much as female as we could. We keep the sensation, we make a cavity, we do the lining, but also it cannot be female. You cannot have 100% like female, of course, but we try to imitate nature as much as we could. That's what we're doing.
Yeah, and it seems like that there are advancements that are still happening, like that are bringing you closer and closer to living that vision of yourself.
I hope.
Yeah, well, we'll see how the future looks. So how does the recovery process work then? So they undergo the surgery. You say it depends on the patient a little bit, but
depend on the technique.
Yeah, okay.
Depend on the technique, but normally we're starting with skin graft. What we're doing is we make a cavity look like a normal vagina, cylinder. So this tunnel is a bare surfaces. We have to do lining by inverted the penile skin, the skin to lining. So the skin will be lining and all the tunnel. If the skin is not enough, then we use skin graft. So the skin graft is the skin inverted and linings. The graft take about 5 days. So with this technique, patients stay in bed for 5 days. After 5 days, we discharge from the hospital. And on the 7th day of surgery, we remove stitches. And then patients wait until another week. We're teaching them how to do dilation, how to take care of the wounds, and then going back home. Okay. But if the technique is more complicated, we use colon, we use something else. It is more complicated. We also stay in hospital 5 days, but we need to do anastomosis, and it depends. If we do like open abdominal, it might be take longer time for recovery. But nowadays we use the laparoscopic, faster recovery. It might be 2 or 3 days, and then patients start walking and eating.
Wow. Okay, cool. So it's becoming faster. To do this turnaround. That's wonderful.
Correct.
All right. Well, I have to ask you some of the naughtier questions now. Sex. When is it possible to engage in the romantic activities if after the surgery?
We can say that after the wound healing of the wound take about starting from 6 weeks to 6 months. So you can start have sexual contact after 6 weeks when all the stitches removal or the wounds healing. But 6 weeks is the earliest. But sometimes patients is try to examine themselves. Maybe some of them starting earlier, but depends. Depends.
Okay, cool. Yeah, but after 6 weeks, relatively
Yes.
safe to
The
engage.
The wounds heal.
Okay,
Yeah.
cool. Yeah, I mean that's obviously something a lot of people are curious about because yeah, it's I mean, as reassigning your gender, doing all of this stuff, you want to eventually live your life in a way that you can engage in these activities, I guess, with new partners or old partners, whatever it might be. But yeah, it's just I don't know, fascinating to me to learn more about it. So let's say if someone is coming from abroad to do the surgery, how long can they expect to stay in Thailand before they're able to go back home?
Depends. Mostly my patients stay 2 weeks because 2 weeks is good enough for them to recover. But maybe some of them stay a month or depends. Depend on the situation. Is there any complication? Are they comfortable to walk or to? But mostly 2 weeks they can go back.
Okay, cool. So yeah, not and 2 weeks in Thailand. I'm not complaining. Yeah, and what you mentioned complications. What are some potential complications that could arise from these surgeries?
Oh, a lot of things because we're dealing with the tissue around there is very highly vascularization. Your contamination by urination or defecation. So a lot of contamination. So there might be some degree of infection, a lot of things.
Yeah.
But mostly because we are doing this for a long time, then the complication is not that much. Sometimes there might be bleeding, but that's considered in hand.
So yeah, it's the risks are there, but usually not so bad, right? Like,
Yeah, we screening patients beforehand. So if there's any patient is high risk, we do something easy like skin graft or something very fast to make patient good recover and then go back home easy.
Got you. Yeah, trying
We
to.
do some patients very old age with some disease, but because they want to die as a female, so sometimes we did that.
That's crazy to me. Making dreams come true even at at advanced ages.
That's why we have to say that because we don't understand, we are not in that situation, so we cannot say anything in under their point of view.
Right. Yeah, and I think this is why Thailand is such a welcoming place for this community and people wanting to go through this process because there is this empathy. Like, yeah, maybe it's not for me, but I want to understand you, and if it's your journey and your process, I accept that. So
let's say this. One of my patients said she feel more relief when she's here because in Europe or in America they accept themselves late, not like in Thailand. In Thailand they know that they're different when they are toddler. So when you are toddler, you see that 6 or 7 years old boy and girl, they look the same because they doesn't have any hormone effects. When they are become teenager, the male hormone starting grow, so their body change to be male. Their shoulder become triangle, their hip bone is triangle. But in female, their body becomes slimmer, they have breasts, they have waist, they have hips. But when transgender in Thailand, they knows they're starting hormone from they are toddler. So they like a group therapy in school. They're teaching each other how to take hormones, how to inject that hormone. So they become more feminine. In contrary, in Europe or in America, before they realize that they are different, maybe they are grown up So their body become male already.
Right.
So they don't know how to dress up or to wear the makeup to live as a female. So they feel reluctant when they are back home. They might be not accepted from their families or society or office. So when they come here, they feel more relief because Thai people is not judging. They are more generous. They accept in who you are, and no matter what you are, they are friends.
Yeah.
So that's why when they're here, they're not judges. They're not looking you like a weirdo or a queer or name it on your face. So they feel more relief.
Yeah.
That's what our societies that I told you that we are multicultural in our society. So we are more accepted. So when they're here, they feel that they are relieved, accepted, and that's why we are the capital of transgender.
Yeah. This is you touch on an interesting subject. Starting hormones at a young age is very important in order to achieve, desired results, like a more feminine body, a more, more like what they feel like on the inside. How young would people in Thailand be when they begin these hormone treatment programs?
I think they're starting maybe like 13, 14 something.
Yeah, just right at puberty.
Yeah. Before they're starting puberty, they knows. So they're starting have hormones and their body become changed.
Yeah, this is a big issue in the States. A lot of people say, this is like, we're brainwashing the children. We can't let them make these decisions. I think there's still no gender reassignment until after 18, though. Is that correct? Or do they do it sometimes younger?
Honestly, I have no ideas about this, but I see some kids, they know that they are different from their kids.
Right.
So different. But this is not my expertise because I'm the one who do surgery.
Yeah.
But this process is maybe in psychological point of view.
Yeah.
Not my expertise. But I seen a lot of patients, they starting when they are very young.
Right. Just for example, what would be the youngest patient that you've worked on for
20.
20.
I'm not doing under 20 because as a doctors, I must have if under 20 they have might have patients a guide, but before they are grown up, they have to be made their mind, they have to be on the process. So I'm not doing under 20.
Right. It's it's irreversible at that point. So being an adult is important there, but beginning that process is so important to achieve those results. I always think it's the silliest thing to try and look. When I was a teenager, I knew I liked girls, right? And I had gay friends growing up at that time. It was very clear that they were gay from a very young age, and they knew what they were.
One thing I have to tell you this: gay is not transgender.
Of course,
gay is a test.
Right.
So you know that a long time ago from Roman, gay also in the history before. So if they are gay, that means they are still men.
Right.
But they want to have sex as a man with a man. Right. So that's different.
No. That's the point that I'm making is that if we can understand these things and we can accept that I know that about myself, they know that about themselves, why can we not accept this about transgender people too?
But if you talk like this 40 years ago, they might think you are different.
Right.
So people in older ages, they said you are born as a male, you have to be a male. You're born as female, you have to be female. They're not accepted for varieties. But now, because educational and lifestyle and everything, they know that sometimes they're different. They're different. So the acceptance is the most important. They cannot be just only two choice. That in my point of view.
Yeah. No, it's a cultural thing.
Yeah.
As the culture is shifting and changing, there's more acceptance in the world too. But of course, there's always a reaction to that as well, usually from older generations. So, Well, okay, so we start the hormone process early age. That I think that's a good thing. How long does the hormone process work? Are they on hormones for the rest of their lives, or what's going on? Yeah,
Of course.
yeah.
Of course. Because when you are young, you have male hormones. When you do surgery, you have to stop the male hormones and you don't have any hormones anymore. You have to take hormone from outside. If you are not taking female hormones, then you become like menopause. Same.
Oh, interesting. So just continue. It's just like taking your medicine, basically.
Yes,
kind of thing.
but at that time after surgery, you have to consult the endocrinologist to prescribe. They have to check your blood level. You have to check your physical end organ if there any risk of cancer or not, something like that.
Interesting. That's it's a big deal. It's a big process, and a lot
Now
of
we
consideration.
come to the era of scientists. We're not speaking in the just only we think, we hope,
Yeah.
but now it is a scientific.
Right.
So we have the measurement, we test, we follow up, we examination in everything in scientific point of view.
Oh, interesting. Well, speaking of other surgeries, though, what about voice feminization? Is this a surgery that people can undergo with you?
No.
No. What does this mean then? Like, how do is that a process?
You have to understand this. The function of vocal cord is the tightening of the vocal cord. So the vocal cord is like a string in piano or guitar. The quality of the voice is from the on the size of the vocal cord. For men, the size is bigger. For female, the size is smaller. So you have the voice tone lower or higher, depend on the size of the vocal cord. But if you tightening the vocal cord, can make it high pitched tone like "Hello, who you are," something like that.
Yeah.
But if you tightening the vocal cord, it's gonna be like you imitation,
Okay.
but not. You cannot change the quality of the voice.
I understand.
So if you tightening the vocal cord, you can have a higher pitch tone like you pretending,
Right.
but it's not will be a feminine. So no point.
Okay, interesting to know because I think that's another aspect of things that people are interested. Do you think that maybe down the line that there might be some processes, or it's just not possible?
To my opinions, I've seen is still not working yet.
Okay, not yet, but we'll see.
Not yet.
Let's talk a little bit about technology then. How is the technology that is being developed shaping the future of gender reassignment surgery?
I think now we are come to the highest because outside we can imitate nature as much as we could, and inside we also have a lot of technology that patients have a faster surgical time, faster recovery, and have a very natural touch. I think we come to the highest, the top of the quality.
So we're pretty much there. We're almost at the top. Is that it?
Yeah, I think so.
That's fantastic. What do you think about creating more, like going through these medical processes? I guess it's a very different culture in Thailand than it is in the West. How can there be a more inclusive approach, like so that people feel more comfortable going through this process? What can be done to just make it a better journey for people?
I cannot tell you that because that's not my expertise, and I think we cannot guide them because we are not. They have to aligning themselves. We cannot tell them you have to do this, you should do that, because they have to make up their mind. They have to exploring themselves that they are one of our candidates. Then I have to consultation for surgery. If they're still reluctant or they're still not made up their mind, they're still finding themselves, then it's not duty to talk with them.
Mm-hmm.
I'm talk with them when they are already ready.
Yeah.
Yeah,
They've
so
decided.
they might find themselves with a psychologist,
Mm-hmm.
or they must listen to themselves. If they're different, maybe they're different, something else, not
Mm-hmm.
transgender.
Right.
You have to make sure that they are really transgender patient, because some of the transgender, they don't want to have a surgery also.
Oh yeah.
They want to live that good enough for them.
Yeah. Lady up here, boy down there. That's yeah.
Of course,
that's-
of course. Yes, there's varieties.
Mhm.
So there might be not a good candidate for surgery. So that's not my job to stand there and talk to them. You should do this, you should do that. But if they made the mind already, then we see
Yeah.
each other.
So going through that process, they spend years with the psychologist. Is that it? So just trying to talk it out. And make
At
sure-
least 3 years.
At least 3 years.
Yeah.
It's crazy.
Before they pass the examination and they're living as a female. They have to living as a female, and they cross-dressing and go out and see if they feel comfortable or not.
Yeah. That's I mean it's just such it's a long process. And it's
They should because in between that time, if they change their mind,
yeah.
then they can coming back.
There is there's a
of
point of
course.
return still.
Yeah.
That's
Correct,
very
correct.
important. How often will they be seeing a psychologist? What is the like?
I don't know.
Yeah, don't know.
I don't know.
Not your decisions to make. I guess.
Because some patients need to be examined often.
Mm-hmm.
Some of them might be good enough. So there's different.
Yeah,
They're different.
yeah. I mean, everybody's an individual. Like it's
Correct.
a unique journey for everybody.
Correct.
Yeah. So, well, let's say, what would be some advice that for people considering to go through this process? Like you've are you working on patients you're working on Thai patients, you're working on international patients as well?
Correct.
Yeah. Where are the people coming from? Are they coming from Western countries or
Everywhere.
everywhere?
Everywhere. We have patients from Mongolia, China, Arabian country, America, mostly American, Australia, Japan, China, Philippines, Indonesia, all over the world.
We were talking a little bit before the show actually about the K-drama Squid Game. You were mentioning that there was a transgender character in the most recent season. Can you go into detail about what that actor is planning to do?
Actually, I mentioned because I presume this is we call soft power. Like when you want to do surgery, people say go to Korea for cosmetic surgery. You want to buy a ruby, you go to Burma to buy a mokok ruby. So that's belief.
Yeah.
So this character is a soldier, and they're playing this called Squid Game, because if you are winning this game, you got money, and he says after he got the money, he go to Thailand for transgender surgery and living as female in Thailand. Yeah. So there people believe that if you want to do surgery, you have to come to Thailand because it's good, it's cheap, and it's high standard and safe.
Yeah. No, that's there you are. You got that soft power, and it's
Yeah.
the
People
largest.
believe.
Yeah.
So now we have a very famous transgender females who's a very famous actor going global with the feminine looking. A lot of them.
Yeah.
And a lot of shows that from transgender they do something like this. I call that this is also one of the soft power.
Yeah. So they're out there showing off your work, basically, right? Like
Now they know that if you want to do surgery, transgender have to come to Thailand.
Yeah.
That's it.
that's wonderful.
That's a message that in this case series.
Yeah. Could you possibly mention some of the patients that you've worked on that have been outspoken about the success of these surgeries? And I know that there's plenty of trans people in Thailand that have put themselves out there to be advocates for this community and to make people feel more comfortable in going through this process if it's something that they feel?
We have a very famous trans Miss International Queen last year named Fuchsia. She's from Philippines and she's very gorgeous, and now she's become ambassador global. We also have Miss Rock Kwanlada, also Thai, also famous in transgender, and now she's become global and in the series, a lot of series. Some of them is our representative of our hospital also.
Yeah, that's so your work is getting out there.
We can see her picture in this. We can insert the pictures to see how they look like, and you're not gonna believe that they are more feminine than female.
Yeah, absolutely. I saw some of the pictures beforehand. Stunning, very beautiful.
Because they know what men want.
They have the inside.
Yes, they
scoop
know
on
that what men want, so they know that how is beauty in terms of what men like.
Yeah, very fascinating take. Yeah, it's obviously, Thailand it's just been part of the culture here for such a long time, and that acceptance means that the questions of doing these surgeries, getting on these hormones, starting these procedures has never really been too big of a question here, as it has been in Western countries that have been a little bit more nervous about the whole process. What are the so Thailand is number one, of course, in terms of transgender surgeries. What is number 2 or 3? Where else are these surgeries popular in the world?
In my hospital?
Oh no, I mean like other like Thailand is leading the way. I would say. Who else is in company with Thailand? Where do we see a lot of other countries maybe starting to engage with this?
I think the States. In America, they also do a lot of transgender. Belgium also, because one professor in Belgium also studying from Thailand also. And they do a lot of female to male. In Genk, in Belgium. Professor Monstre, he did a lot of surgery also.
It's very fascinating that, we always talk about going to study with some of the leading surgeons in the world for different processes like, cardiologists, oncology, that kind of thing. Seems like the experts are here in Thailand for this particular surgery.
Of course. We are in this business for at least for 30 years. My mentor, Dr. Prisha, he did this for, I think, more than 50 years. And we're learning by mistake and a little bit acknowledge accomplishment. And then we're starting to grow our insight technology.
Yeah.
So that's why we are leading. In my hospital also, we have... a lot of doctors coming here from China, from Singapore, from Indonesia, all over the world coming, Mongolia coming to see and learn and be our apprentice.
Yeah, leading the world. Then that's amazing that you're.
I hope.
Well, you're bringing that knowledge to so many people around the world, like that can now, like these doctors are now able to help people in their own communities.
Yeah, because this is not hidden. Surgery like abortion or something that you need to hiding behind the curtain. Long time ago, this surgery is not accepted because people lose their face if they do a lot of surgery. In a leading hospital in Thailand, they're hiding people, a lot of clients behind because they don't want to have the transgender patient walk in the hallways to show people that they are transgender. They feel they're losing their face. But you have to admit that if you want to do surgery, you have to go to the hospital that it is very high standard accreditation in general hospital in Thailand. So a lot of leading hospital now, they are more open-minded. They want to starting acceptance, but they're far behind because before they don't do this, their doctor also doesn't have any knowledge.
Yeah. Well, I'm glad times are changing.
Yes.
Now, before we wrap up, I just want to ask, what is some final words of advice for anybody who is considering making their transition?
One thing is, if you are needing help, you know that you are different from the others, and you want to find a way out. Sometimes you need to find a solution. That's why you are different. And if you are screening to be one of our good candidates, please consider our hospital in your mind, that we can help, we can find your way out. And if you think we can helping you from this situation, maybe you can consult our allied medical partner, or you can search our hospital, or you can search our doctor accreditabilities or expertise. Not just only my hospital, but any place that can help. At least we find your way out. And if you are good enough, we are here.
Beautiful. Well, yeah, thank you so much, Dr. Saran, for coming to join us. And I will say, yeah, if anybody has any questions about this, no idea where to start on this journey, definitely consult with Allied Health Thailand. Who could partner up they have the medical expertise. They could partner up with experts like our lovely Dr. Saran right here, who is one of the leading minds in this field. So they have the resources on hand to be able to help you and hold your hand through this journey, which is, it's a big decision. It's a big step, but it could be life-changing and putting you on the path to being the person that you want to be. So for me, I think it's really wonderful, the work that you're doing. And I just wish you all of the best as you continue.
Thank you very much.
Cool.
Thank you for inviting me, and thank you, Alignment, for inviting me in this show. I hope that this will help people more or less.
Yeah,
thank you very much.
I think you will. Cheers, guys. Well, thank you, everybody. We'll see you next time.
Thank you.
Cool. All right.
I hope we get something that people understand.
Yeah.